So, welcome to the Home Healthcare Today show. I'm your host, Dr. Cleamon Moorer. It's June, folks, and June is Men's Health Month. What do we want to talk about this week besides men and some of our challenges as related to health? Definitely, we want to talk about that. But we want to dive a little bit deeper, right, into men's, heart disease, men and prostate cancer. Let's go into some stats here. Men in the United States live 5 years less than women. They have their first heart attack an average of 10 years earlier. Men are 4 times more likely to die by suicide and twice as likely to overdose. And yet, men are statistically more likely to skip routine checkups, downplay symptoms, and delay care that could save our lives. As I noted, June is Men's Health Month, and this year's theme is Partners in Care for Better Lifespans across the lifespan. A reminder that men don't have to navigate their health alone. My guest today has spent more than 4 decades fighting for men's health. He's a board-certified urologist who practiced medicine in Metro Detroit since 1986. He served as co-chair of the Prostate Cancer Task Force for the American Society in the Great Lakes region. He founded one of Michigan's first Us Too prostate cancer support groups, and today he serves as president and CEO of the Michigan Men's Health Foundation. He earned his medical degree from Chicago Medical School at Rosalind Franklin University and completed his residency at Henry Ford Health. He's presented at the National Men's Health Brain Trust in Washington, D.C., and remains one of the most respected voices in men's health advocacy in our state. Dr. Michael Lutz, welcome to the Home Healthcare Today show.
Great to be here. Thanks for having me.
Doc, let's go there. You've dedicated more than 4 decades to men's health as a clinician, an advocate, and now president of the Michigan Men's Health Foundation. When you look at the state of men's health in America today, what concerns you the most?
Well, I think the best thing that I can say is that I think things are looking brighter in the sense that men in general are becoming more proactive about their health. It's definitely a generational change. And you can see that men in their 20s and 30s and even into their 40s are significantly more proactive about the importance of being healthy and leading healthier lifestyles. The problem we're dealing with is we have an excessive amount of men now, of the boomers that are now in their 60s and 70s and 80s, who are suffering significantly from many of the other illnesses over time and have not been as proactive. And because they have not taken much preventative care measures, we see a lot of increases in significant diseases at this point in time. But I believe, looking forward, that there will be a brighter future.
Absolutely, Doc. Well, very good. I support you in the belief, Doc. When we look at some of those stats that you noted, they're staggering. Men live 5 years less than women. Us as men, many of us have heart attacks a decade earlier than women. And then, suicide amongst men is higher. Why do you think men's health, why does our health outcomes lag those of women?
Well, we know that men are control the leading cause of death amongst the top 10 causes of death. They lead 9 of them. So, and when it comes to suicide and risky behaviors, we know that men have a much higher incidence. And we don't know the exact reason why men have a higher suicide rate or the difference in the types of suicide that men perform versus women. But we do know that men in general are not as proactive about their health and are seeming to have issues now in falling off as far as their success relative to women. As far as education and success in the job force. So we know that men are struggling to find their place in society and to do well. And so we need to find ways to help bolster men in their need to succeed, and not only health-wise, but also emotionally and functionally.
Absolutely, Doc. Yes, I thoroughly get it. I agree. I mean, when you talk about jobs and stress, and then the thought of, will I have enough when I retire? Will I be able to, live without working, or, without working at full strength? We downplay some of those symptoms because we're out there trying to work so hard and get it in many cases, and we delay care. From your experience, Doc, what's behind that reluctance that we have to just go to the doctor's office? And then how do we change that for men?
I know that I've been asked this question a lot of times in a lot of different ways, but I really believe that the bottom line is that men are not just hesitant about getting health care. It's that it's not a priority.
Mm,
Their priorities are protecting their families, preserving their families, and doing everything they can for their family.
yes, sir.
And as a result, their health care is not a priority. And what they don't realize is that if they are not healthy, if they are not doing well, their family will suffer horribly. The statistics in a family when a husband gets ill or dies is that the children will typically not graduate beyond the high school level.
Wow.
The incidence of drug abuse and alcohol addiction amongst the children is significantly higher. The incidence of suicide for their children is significantly higher. So the
Wow.
health of the male in the family is absolutely crucial to the health of the family. And so what I always talk about is that men's health is not a selfish thing about the men. It's really more about the health of the family. And our
Yes.
goal is to always to try and support men's health with the primary goal of saving the health of the family.
Wow. I love it, Doc. Very good. Very good, Doc. Speaking of men and the health of the family as a whole, there's many families out there that are watching the show today, this morning, and they're thinking about prostate cancer, and how that has impacted a man within their family line. As we think about prostate cancer screening, and you've been a part of this for many, many years, Doc, prostate cancer is still the second leading cause of cancer death amongst men in the United States. What do men need to know about screening? And when should they start to have this conversation with their doctor?
That's a great question. And a lot of times physicians are given information that may not be up to date
Mhm.
or actually accurate in the sense that they don't have access to accurate information because the U.S. Preventative Services Task Force continues to muddy the waters as to the role, accessibility, and value of screening for prostate cancer because they don't really understand that there are so many new advances in screening opportunities that have progressed since the time of the U.S. Preventative Services Task Force recommendations back in 2015.
Wow.
We know that we are presently in the middle of a global epidemic of prostate cancer, not just
So,
here in the United States, but everywhere across the globe. They're seeing rises in prostate cancer, not only in the elderly population, which is the highest risk for prostate cancer because age is the number one risk factor, but we're also finding higher incidence of prostate cancer in men in their 40s and 50s. And so what we are recommending is that men take advantage of getting screened. And the screening test is just a blood test. That's all it is just a blood test. It's called the prostatic specific antigen or PSA blood test. And this
mm,
blood test has been around since 1979. The
wow.
reason we know that this test is effective and has worked is based on numbers of international trials for screening that have been taking place since the 80s. And the data shows that screening does prevent death from prostate cancer. And
Yes.
now, with the advances in what we call liquid biopsy tests, which are these blood tests and urine tests, and soon to be saliva tests, they can actually more accurately screen for prostate cancer. The advances in these tests can actually save men from having unnecessary biopsies performed. And so we can screen those who need to be screened those men at
Yes.
risk. And you ask the question is, when do we start screening? Well, if you're a man at
Yeah.
high risk, if you're a Black male, if you're a
Yes.
firefighter, if you're a fighter pilot, if you have a family history of prostate cancer, because if you have a first degree relative, such as a father or a brother with prostate cancer, your risk is 2 times that of the general population. And if you
Okay.
have 2 first degree family members, your risk is almost 4 times that of the general population. And
Wow.
considering there's an overall 1 in 8 risk of prostate cancer globally, that's a high risk. And so getting screened starting at around age 40 with a baseline PSA blood test, if it's below 1, you're considered to be at extremely low risk. When it gets above 2, you should probably seek out evaluation with a urologist who can
Yes.
specialize in these additional tests, such as the liquid biopsy tests I've already mentioned, and or consider the option of additional testing as needed.
Wow, Doc, this is such helpful information, to understand family, family history, the heredity, factor, to understand even the genetic piece as associated with a higher prevalence of prostate cancer, and then getting the screening early, at the age of 40 for those that are at higher risk. So thank you for that, Doc. We're going to take one more question and then we'll go to a commercial. Dr. Lutz, you founded one of Michigan's first Us Too prostate cancer support groups, and we're grateful and appreciative for that. Why was creating that space so important for you? And what have you learned about how men process diagnoses, fear, and recovery a little differently than women?
Well, when men are diagnosed with prostate cancer, they oftentimes feel like they're facing the diagnosis alone.
Mm.
And so my belief in the 1980s, when there were no support groups in existence, we needed to create something, a safe space for men to share this diagnosis, this journey with other family members. And when they share it with their family members, it was becoming evident that the way they share it with their spouse is different than with their siblings and different with their children. And so we needed to have an opportunity for men to share it with all of them. And that's where the Us Too Prostate Cancer Support Group in the state of Michigan was first generated. And many of the speakers we had would actually discuss how families could deal with it, could support it, and be an integral part of their journey through treatment and further on. Many men are diagnosed with prostate cancer and they're not actually treated for the disease. They're placed on what's called active surveillance, which means their disease is monitored just as you would monitor your hypertension. And so these men need even more special support because there's a little bit higher incidence of anxiety, depression that goes on with active surveillance. So mental health support is really a crucial part of the follow-up care of men when they're being either actively treated or being monitored with their prostate cancer for them and their families.
Absolutely, Doc. Well, hey, thank you. Thank you for that work. It does take courage. It does take a fearlessness to an extent. And then for, the support systems out there. So families that are going to nudge the special men in their life to get screened. There's a safe place for it. And to your point, Dr. Lutz, men do not have to face it alone. So thank you for creating such a safe place for men and for families to tackle prostate cancer. All right, folks, we're going to take a quick commercial. We're going to come back and we're going to explore greater depth of conversation with Dr. Michael Lutz. You won't want to miss it. Stay tuned.
All right, now this is commercial, different than our most traditional commercials. This is more so of an infomercial. Yes, I've switched seats with Dr. Lutz for a minute here to just talk a little more about men's health from various perspectives and standpoints. So when you think about men's health, for us older or us middle-aged men, we got to kind of think back to some of those early days, like childhood, for example, right? The 0 to 10, right? Being a kid. So for the granddads and the dads out there, the uncles, the father figures that are out there with those 0 to 10-year-olds, yes, keep pushing them. For the ladies out there, the women, the aunts, the moms, the grandmas, right? The older cousins, older siblings that are responsible for a 0 to 10-year-old in your life. Yes, keep that kid busy as possible, right? Some great movement, because me going on 50 now, the time goes fast. I could think back to like 0 to 10 and like getting to fifth grade, where it's like, when will I be 10? All right, we fast forward, folks. The teens, men's health just doesn't start whenever you become a full age adult of 21 years or older. Teenage years, the 11 through the 18, 19, going on 20. Some of our bad habits start to set in then and there. All right. So thinking about teens, guys, I often think about the acronym STEP. Okay. STEP. As our bodies change, as our minds change, the acronym STEP comes to mind. During those 10 years, STEP, S is for stupidity. T is testosterone, E, ego, and P, pride. Now, you don't think about those elements or attributes of your journey in 0 to 10, but around the teen years, yeah, we start to make some of the not so bright decisions. Testosterone kicks in, the thought of having an ego, and then how do I protect my pride, right? All of those mental and physical and emotional factors begin to kick in as we think about young men's health. So, reaching out to a mentor, a father figure, an individual that can help guide decision making is essential. Having that conversation with a doctor, a primary care physician. So, as you age, the parent or the adult sort of steps out of the room and allows you to have time to talk to your doctor, talk to a physician about things going on with your body, etc. Right? So, not shying away, but also thinking about some of those choices, right? The peer pressure of alcohol, tobacco, weed, and even some of the harder drugs, right? Let's just be cognizant, right? None of us are perfect, but we tend to learn in reverse, in hindsight. In the teen years, yeah, teach us a lot. Men's health. Fast forward to the 20s. Yeah, I don't want to say the roaring 20s, but yeah, 20s. The only problem with the world whenever you're in your 20s is that you don't run it. Like, you don't run the world. That's the problem whenever we're in our 20s. The time is going to go by, guys. Just take the time and just, get the skills, the development, the training, the job pursuits. They're going to continue. The 20s, the 30s, the 40s. That's that adult life. Okay. So we covered some key decades there, adolescence and into the 20s. All right, 30s. I know I got some younger dads out there, that are responsible for the sandwich generation. Once you slide into the 30s, you have your young kids that you're taking care of, but then you also have your aging adults. 30s, 40s, you slide into the unk status, right? You become the uncle. Stress management, diet, guys, exercise. We've learned a lot throughout the years. So the 30s, the 40s. Now, this last couple of groups that we'll talk to, us men in our 50s with the little silver strands, 50s, 60s, 70s on up. Yes, these are the years of transcendence, right? Where we're working, many of us are still working later in life, which is okay. Working keeps us healthy. Some of us are out there retired. Some of us may be homebound. However, you made it. You made it to an advanced round that a lot of guys don't make it to. You see mourning a lot differently. You've saw loss. You've saw challenges throughout the years, but you have been there. You have been that load-bearing beam to keep your family up and to keep your community up. And for that, I commend you for this Men's Health Month. But let's continue to take it easy. Be mindful. We're going to get back, with Dr. Lutz in a little while here and dive deeper. The PSA, getting the PSA tests, doing our stress tests, looking at heart health a lot more seriously is very, very important. Taking the time to think about gratitude. So later in life, we look at our toys, we look at some of the things that we've acquired or have amassed, but more importantly than the boat, the RV, the Harley Davidson. More importantly, our loved ones, our family and friends. Those are the ones that are truly be there for us because we were there for them. All right, folks. Be sure to take care of the special man in your life. If you're that special man, pat yourself on the back for being a special man, not only in your life, but in the lives of others. It's my wish that everyone has a wonderful Father's Day weekend and enjoy um, June, as June is Men's Health Month. And I'm going to get back to Dr. Lutz. Got a few more questions for the good doctor.
All right, folks, welcome back to the Home Healthcare Today show. We're still having an in-depth conversation about men's health with Dr. Michael Lutz. So we're going to pick up where we left off before our commercial break. But a shout out to our sponsor. Our sponsor is Meridian Health Plan in Michigan. Care above all else. And Meridian does provide PSA screening test kits for men through the health plan and through the mobile delivery and outreach of those screening kits. Doc, we're back at it again. You alluded to mental health and the mental health support of men. So we're going to take a few more questions to wrap up this episode, Doc. Men's mental health is finally getting more attention, but the numbers are still alarming. Men are 4 times more likely to die by suicide, yet only 17% saw a mental health professional last year, compared to nearly 29% of women. Why is there still so much stigma around men seeking help for their mental health?
Barriers are being broken every day with regards to the stigma associated with mental health not being considered an actual illness. We understand that it is, and we know that we approach it in that way and make it more accessible. Every year we hold an annual men's health event. This year we'll be at the Wayne State University Fieldhouse on September 26th. And when we do these events, we have significant opportunities for mental health evaluation, screening, and suicide prevention. We believe that mental health is men's health, and that unless you're mentally healthy, you can't be physically healthy. And so we approach it as a really symbiotic relationship all the time in everything that we do. And whenever we're looking at treating an illness or some type of chronic disease state, we always look at what is the mental health implications of that so that we can actually address it.
Very good. September 26th. Very good. We'll mark our calendars for that date, Doc. Thank you. Thank you for sharing that. Okay, a couple more questions. All right. Urologists. Urologists have become the de facto men's health advocate in healthcare. What does that look like in practice, Doc? And how does the role of the urologist, how has that role evolved beyond just treating urological conditions?
I think urologists for quite a long time have always felt that they were the men's health physician, but they never really took advantage of it, as obstetrician gynecologists have always been labeled as the female physician. And so over the last 20 years, the American Urologic Association has actually looked at men's health as a very important part of the services that we provide. And so when we would see patients for visits, whether it be for a vasectomy consultation, when we see younger men, or whether it's later on when we see men for prostate diseases, or when we evaluate men for erectile dysfunction or libido deficiencies, all of those aspects tie into general men's health. They tie into weight, lifestyle, and behavior patterns. And so those are always being addressed in a urology office for those urologists who really want to specialize in men's health as part of their advocacy.
Okay, thank you, Doc. Doc, 2 more questions to wrap up our episode. For the women out there, the partners and the family members who are trying to get the men in their lives to take healthcare more seriously, what advice do you give to the support system of men?
Well, there's no question that women are truly the driving force for men's health, and that the majority of men, I can tell you from my personal experience, would be the ones who make the appointment for the vasectomy consultation, or it's the women who actually get the men to the office for their urinary tract issues or for prostate cancer screening. So women do drive healthcare for men because they care, they're compassionate, they're caring and giving. And that's really what make women such a vital part of overall men's health. When you come to one of our annual men's health events, you will see that the majority of men are accompanied by their female counterparts because they are the ones that believe in the importance of their men staying healthy. And they are absolutely on the spot with that because, as I've said before, if a healthy man is in the family is going to do well.
Amen. Amen to that, Doc. Last question for you, Doc. I read somewhere where you were working on your mobile men's health unit. So we share some commonality in that and like getting into the neighborhoods and the community and delivering care right where people need it the most, kind of mitigating the transportation barriers and decreasing the reluctance factor. When the van is in the parking lot or in your driveway, it's hard not to step out there and get a checkup. Doc, what gives you hope about innovations and interventions such as that, as well as greater awareness around men's health? That's my final question. What gives you hope and what keeps you going, Doc?
I think that we're now in a time of the application of AI, and we can use that tool to help assist us when we try and bring screening opportunities to underserved communities across the state of Michigan and partner with other organizations across the nation. Yes. I believe that we can democratize the screening opportunities so that all men can have the same screening resources that you would have at any major university. And we can actually show these universities and these large medical centers how you can screen more effectively and efficiently by bringing these advanced technologies to the communities. And we can do it at no cost to the communities with great resources and funding opportunities through corporations and organizations that are committed just like us to helping communities around the state and across the nation.
Absolutely, Doc. That is a vision, and it's a vision worth us all going after and achieving. I appreciate your emphasis, on the corporations and the organizations out there that can indeed make the philanthropic contributions to your organization. The Michigan Men's Health Foundation is registered 501c3. So being able to support that work and all of the great endeavors that you and your team are out there doing. Doc, we appreciate you and thank you for being a guest on the Home Healthcare Today show.
Thanks for having me.
Absolutely. And happy Father's Day. I know it's coming up soon, and be sure to enjoy the rest of this beautiful month, Doc.
Yep, and do it for Dad.
Amen, for sure. All right, folks, that does it for this episode of the Home Healthcare Today show. Tune in every Saturday morning at 10 a.m. on WMYD TV 20. Stay safe and be well. We'll see you next week.